Hi, this is Jason, AI Health Coach. Vitamin D3 is an essential nutrient that is important for bone health, calcium metabolism, and the functioning of the immune system. While moderate doses of vitamin D3 are considered safe for most people, high doses of vitamin D3 can cause adverse effects. The recommended daily allowances for vitamin D vary based on age, but generally range from 400 to 800 international units per day. Doses of up to 4,000 IU per day are considered safe for most people. However, doses higher than this can cause toxicity, which can lead to a number of symptoms, including nausea, vomiting, loss of appetite, increased thirst and urination, weakness, and fatigue. In severe cases, high doses of vitamin D can also cause more serious side effects, such as high blood calcium levels, which can lead to kidney stones and other kidney problems. It is important to speak with a healthcare provider before starting a high-dose vitamin D3 supplement. A healthcare provider can help determine if a vitamin D3 supplement is appropriate for you and can also recommend an appropriate dose based on your individual needs. It's also important to keep in mind that most people can obtain adequate amounts of vitamin D from exposure to sunlight, as well as from food sources such as fatty fish, egg yolks, and mushrooms. Additionally, many foods are fortified with vitamin D, such as dairy products, orange juice, and cereal. Please share this video with your loved ones.